Hi, I'm Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And this is a very fascinating case that involves her sacroiliac joint, but also her lumbosacral facets. And it involves a reflex hyperextension in the upper cervical spine. And what I'm going to suggest is that by treating hypomobilities in her sacrum and the lower lumbar spine, that if we correct motion there, restore motion there, that the upper cervical spine will release reflexively, and I won't even have to touch the upper cervical spine. So I'll show you the restriction in the low back and sacrum, and I'll show you the restriction in the upper cervical spine. But the first thing that I want to do is show you through an anatomical model the things that I find. In a normal person, you should be able to push on their pelvis, and this is called the ilium, and you should be able to push and get some rotational force going through it, and you should feel, I should be able to push to a stop point, and then I should be able to add additional force and get a little extra movement, but it should bounce back with integrity. Okay? Now what I find is that when I push on Lynn's pelvis, I can push to that stop point, and that's called taking up the slack. And now I'm going to add an additional force equal to the first force. Boom, there it is. And it bounces back, but it actually bounces back slowly. It doesn't bounce back with strength that I would expect it to. So that clues me in to suspect that there is something going on with the sacrum not moving normally. Okay? And this exists on both sides of the pelvis. When I take up the slack on the right and I spring it, it just doesn't recoil back with strength. Okay? Let's have you lie on your stomach. And what I find with her is not based on how things look, but it's based on how things move. And what I find is that on movement testing, I can get her sacrum to bounce backward and get a little bit of movement in the lumbosacral spine where the L5 vertebrae connects to the sacrum. Probably a little bit movement happens in the facet joints above that at the L4, L5 vertebral segment, but I cannot get anterior movement or forward bending of the sacrum. So her sacrum, when I spring it, when I push on the bottom of her sacrum, I can get it to bounce backwards, but I cannot spring it on the top and get it to bounce forward. And I cannot get the L5 vertebrae to bounce forward. So I'll show you that spring test. And I'm suggesting that those are related to the upper cervical spine, and you'll see the restriction there shortly. So I'm isolating the PSIS as these bumps in the ilium, and that defines a transverse axis through the sacrum. And the upper sacrum is up here. So I'm trying to load her very gently, very slowly, and get some movement there, but there is no movement. I can't take up the slack, and now if I impart a reasonable amount of force, being gentle, there's no movement. If I come up one level, I'm now on L5, and I cannot take up the slack with a reasonable amount of force. And now I come up to L4, and now I can take up the slack. And I don't know, I think the camera can see that I can now take up the slack at L4, and now I can spring it, and it moves forward and it bounces back. And now I'm going to come to the lower sacrum, and I can take up the slack, and I can spring it. And I think you can see movement through her body, but let's look at her feet. Can you see that her feet move? I take up the slack, and then I spring it, and it bounces. So we have backward bending of her sacrum, but we do not have forward bending of her sacrum. And to preserve her privacy, I'm going to put a Kleenex on her face. We'll have her lie on her back, and I'll show her the restriction in the upper cervical spine. And I'm suggesting, based on my experience, that when I free up sacral motion, I'm suggesting that the motion at the atlantoaxial joint, the C1, C2 vertebrae in the neck, that motion will be freed up. So let's have you lie on your back and wait till I put a Kleenex on your face. Okay, so Lynn is laying on her back, legs are out straight, and I'm clasping the temple area because the upper two joints are right below the ear, the lobe of the ear. The rest of the cervical facet joints are in the back of the neck. So if I want to distract the upper two joints, I must have my force in front of the ear. So the palm of my thumb and a little bit of the palm of the hand is going to contact the temples. And now I'm stretching. I get no motion at all. I get no movement whatsoever. Okay? Using a reasonable amount of force. Now I'm going to drop her head backwards. That's about 10 degrees. And I'm trying to do the same thing. And with a reasonable amount of force, I don't get any movement whatsoever. Now there is movement when we have her in flexion, so I'm going to lift the head up about 10 degrees. I can now take up the slack and I can then add a little extra force and I see her feet bob up and down. So we do have movement in flexion, but a person with a normal functioning upper cervical spine should have traction mobility with their head in neutral, and they should have it with their head back in a little bit of extension. And so all that I'm going to do, let's now film on her pelvis and we'll have you lie on your stomach. Okay? So go ahead and, film away from her. So let's have you on your stomach now.
I wanted to comment that when you're pushing in that area, my foot immediately cramps.
Oh, is that right?
And it's always like that. Anytime the Walfer works there,
oh, is that right?
My foot just goes into a cramp.
Interesting. Okay, so I have your face down for a little bit of comfort, but actually I'm going to put 2 pillows under your chest. So that'll put you in passive extension. Good. You okay there?
Okay.
And then I'm going to get another pillow. And I'm going to put this pillow under your feet. Lift your feet up. And I'm going to push on the top of her sacrum with a very, very small amount of force. It's going to be about 10 pounds of force. And I'm going to apply that force for 5 minutes. So we'll stop filming now, but I'm basically pushing at S1 at the top of the sacrum, posterior to anterior pressure, very mild force, 10 pounds or less. If I were to compare on a bathroom scale, it would be very similar. So we'll stop filming now. I'll treat her, and then we'll come back and we'll test the movement in the sacrum and in the ilium, and we'll also look at upper cervical motion. Thank you.